Imagine going from being physically active every day to not being able to do much of anything at all without an excessive amount of pain. Well, that's been me for the past year and a half, and today I want to inform you what it's like to have a herniated disc, tear, and arthritis in your lower back. Although I'm still dealing with these injuries, I want to tell you all about the causes, the symptoms I've had, treatments, prevention, and the prognosis. I have had countless injuries, but this one for sure is the most aggravating one I've experienced. Let me give you a little background information. According to the Mayo Clinic, a herniated disc is a problem with one of the rubbery cushions, which are called discs, that sit between each vertebrae that's stacked to make your spine. The discs that make up your spine contain a soft, jelly-like center, which is considered the nucleus. They're covered by a stronger, rubbery exterior called the annulus. A herniated disc happens when the nucleus protrudes through a tear in the annulus. Next, a tear occurs when ligaments are overstretched or overused. These ligaments are fibrous tissues that are thick, which connect the bones together. Lastly, arthritis happens when the facet or the sacroiliac joints between the spine and pelvis are inflamed, according to doctors at Johns Hopkins Medicine. These are all diagnosed by a number of x-rays and MRIs. Now that you're aware of what exactly each injury is, let's dive into the causes of each of them. There are so many ways to get a back injury like this one. Like most people though, I'm not able to pinpoint exactly when I got the injury, but I do think it was either at a volleyball tournament or lifting weights. When you utilize your back when lifting heavy objects, instead of using your leg and thigh muscles, you may eventually end up with a herniated disc. Also, twisting and turning while lifting something can lead to an injury like this as well. Another common cause of a herniated disc is falling. A tear is caused by overuse, fatigue, and improper use of a muscle, which was medically reviewed by William Morrison, MD, on the Healthline website. Spinal arthritis is often caused by wear and tear, autoimmune disorders, infections, and more, which was researched by medical professionals at Johns Hopkins Medicine. Next, I want to introduce the symptoms I've encountered with each of these injuries. The first time I felt this problem was bending down and pick up a water bottle at a tournament. Immediately, I knew something was off, considering I had excruciating pain in my lower back. But I shook it off at the time, thinking it was just a pulled muscle. It wasn't until the following day at school I knew that there was more to it than that. I couldn't sit in my chair at school without being in pain. Then I felt numbness, tingliness, weakness, stiffness, burning, achiness, and sharp pain down my legs and in my back. So after I felt these symptoms, I knew it was time to see a doctor, which is when I found out I had all three of these problems. These are all the most common symptoms of a herniated disc, especially having radiating pain from your spine down your legs, which is further shown by research done by the Cleveland Clinic. This pain often goes down your legs because the disc is pressing on a nerve, which I later found out. Now that you all are aware of what the symptoms that come with the back injury are, let me tell you all about the treatment. There are so many ways to treat these injuries. For starters, let's talk about the steps you can take to treat a herniated disc. When I first got the injury, I began icing every night in addition to taking non-steroidal medications like ibuprofen and an anti-inflammatory like meloxicam. I began physical therapy where I completed exercises to stabilize my spine, strengthen all the muscles in my back, and make my core stronger. I received 2 epidural injections in an attempt to get rid of the nerve pain going in my legs. Currently, on top of physical therapy, I often get a massage as well as go to a chiropractor to get my back aligned and decompressed. Some other things I've tried to help with the inflammation include ultrasound therapy and the utilization of a TENS unit. If your injury is bad enough though, you may need surgery. These efforts I've made to treat the injury have been recommended by multiple doctors and mentioned on every website, including the Cleveland Clinic. To treat a tear, you simply have to rest in ice, and the treatment for arthritis includes taking non-steroidal medications, physical therapy, and injection, and even surgery sometimes is recommended as well. Although I've made most of these efforts to treat them, it ultimately takes time and rest. Looking back, I wish I took more precautions to prevent getting these injuries all at once. If you use proper lifting techniques and focus on keeping the correct form, you can avoid getting a back injury like this. Other ways include keeping a healthy weight, practicing good posture, which I need to do now, stretching, exercising regularly to keep your muscles strong, and eating healthy, which was also researched by medical professionals at the Cleveland Clinic. On the other hand, a herniated disc could also be genetic, which is obviously unavoidable. It really can happen to anyone despite how young and healthy you may be. Now that you all know the precautions to take to avoid having this problem, let me close off by giving you the prognosis. Originally for me, it was supposed to take at the most 6 months to heal, but a year and a half later, I've had no improvements. Every doctor will tell you it just takes time to heal and that it could be weeks, months, or even years if you're like me. I hope you all took something from what I've told you today. Please take care of your bodies and never take anything for granted.